Hello everyone, I'm DC. You know, stage 4 cancer smashed my body and my life twice in 2 years. I was broken and in bed for years afterwards, paralyzed after doing 3 years of solid heavy dose chemotherapies. But now, 10 years in remission, you've seen the 8 habits that got me into remission and kept me here for 10 years. But after doing a couple of weeks of tests recently, today I'm going to show you the test results that will show the good and the bad, and I'm going to show you some of the long-term and permanent organ damage that chemotherapies do to patients. Okay, so when I was first diagnosed in 2012, they told me that follicular lymphoma is a type of blood cancer that's recurring and you will never be able to get rid of it. There's no cure for it. And I was inoperable. It's in my bones. I had a large tumor wrapped around my aorta. All of my lymph nodes were malignant tumors. It was everywhere. It was multiple organs and so on. That's very high stage 4 is. I had a 2% chance to last 3 months. I only had one kidney working at 12%. And this would require, the only way I could manage it is through chemotherapies, right? And because I was already very high stage 4, it meant that I had to be particularly heavy dose chemotherapy as well. But the catch is with follicular lymphoma, the more you treat it, either with a heavier dose or the more often you treat it, the less likely you are of having a longer remission period. And because of the treatments itself, the cancer itself will become more aggressive and will require more treatments for the rest of your life. That's what they told me. Alright. So basically you're screwed. You have absolutely no chance. The only thing you can do is just keep taking more treatments until eventually you just can't take anymore. But after the last couple of weeks of rigorous tests, I've been doing urine tests, CT scan, ultrasound, blood tests, and so on. I am now what they call N.E.D. That is no evidence of disease. That's incredible. To me, that is absolutely amazing. No evidence of disease. I never thought I would even get to this point. And no one did. No one thought I would make it through the first treatment session, let alone the rest of it, right? So this is incredible to me, and it may be a first. I'm not sure, but it may be a first for follicular lymphoma. Okay, so that's the really good news. So we'll go through these numbers, and some of these numbers look quite bad, but these are leftover organ damage, scars, and things like that that contribute to these numbers. If it was someone without any sort of organ scarring or anything like that, these numbers would be of concern for someone maybe pre-diagnosis perhaps, but there are other numbers that you need to take into account, and we'll go through that as we go anyway. So let's get into it. I've got 3 piles of tests, right? So I'm not going to go through like every single detail because that would just take too long. So I'm sorry I don't have a digital copy for you, but I'd like to get the print off so that I can study these and research them and stuff like that. So, but this is, for example, like just the urine test. Okay, so I will just summarize basically, and I'll show you the key points anyway. Some of the numbers I will type up and put on the video for you and explain some of the bad points as well, and why I'm doing pretty well. Anyway, so to summarize this one, the summary, this is from the renal ultrasound scan. Okay, the history here is kidney disease stage 3. Okay, because now the reason I had kidney disease is because of the large mass that I had wrapped around my aorta. The largest tumor I had was so big that it was sitting on both of my kidneys, and it caused my left one to fail and to shrink, and the right one was just down to 12% capacity, flow capacity. So that was the cause of that. So there's also residue scarring from the tumor, but also from the chemotherapies as well. Okay, so these are some of the numbers that are going to be a little bit off for my kidneys. But yeah, to summarize this one, left renal cortical defect scar. Okay, that's what they're talking about there. Mild left-sided hydronephrosis. Okay, they don't know the cause because they don't know the years of chemotherapy. This because I relocated, I'm seeing a new GP and they want to run all these tests. But for me, I'd like to do these tests every now and then just to check everything anyway. No right-sided hydronephrosis, so bilateral, so that's pretty good. Like the left one has got most of the damage from, one is the one that has most of the damage from my tumor, but they both had scarring, and the left one is actually so small that it's not actually working at all. So that really accounts for the numbers that I get from other things, other tests as well. Okay, so in summary, the bladder wall is thicker than usual. It could be due to infection, inflammation, or a tumor. Okay, but they don't know the history of the fact that I've been through so much chemotherapy, and after the chemotherapy, I've explained before, I had layers and layers of skin peeling off of all my internal organs, my esophagus, stomach, everything. Okay, so it was like kind of like shedding skin like a snake does, and this would also account for the thickening of my bladder wall. It can be caused by obstructions like scar tissue as well, and other things. It just says here that doctors should check urine for symptoms and clues. Mild buildup of fluid on kidneys, which could be caused by blockage or scarring. Now, my kidneys have a lot of scarring because of the tumor and because of chemotherapy. So I do have fluid buildup on, just a mild fluid buildup on my kidney. But in this case, it's just due to the kidney damage or the scarring. So that's really not a big deal, not a big concern at the moment. Okay, so the urine test, this was done over 3 days to get an average. Okay, now the most important thing on my urine test is that all 3 days showed up negative for high-grade urothelial carcinoma. So no sign of any cancer cells in my urine, which is really good news. Okay, the urine itself doesn't have pH of 5. Okay, so it's healthy. No protein, no glucose. Leukocytes below 10 and healthy. Erythrocytes the same, and the rest of it is all the same. Again, the most important part there is there's no cancer cells in my urine or protein or glucose. So really good. So that's day 1. Day 2 is exactly the same actually. So it's very stable. This is because my diet is very stable. Okay, so no anomalies in the first 2 days of urine test, and the third day is the same as the first 2, just a slight deviation in a couple of the numbers, but you'd expect that. It can't be exactly the same every day, but all in a healthy range. And again, the most important part is negative for high-grade urothelial carcinoma. So no cancer cells in my urine, protein or glucose either. So excellent. I'm really happy with that. That's very good. I don't think they could ask for more than that, really. Okay, so the next test was prostate-specific antigen, okay, or PSA. That's what they call it. Now, total PSA is anything below 3.0 units per liter, okay, and is healthy and low risk. And mine is at 0.7, so that's really good. Okay, have any kind of cancer cells in prostate. But again, isn't meat supposed to cause prostate cancer? Well, there you go. I have proof. Okay, no prostate cancer, even though I only eat meat and eggs. Wow. HbA1c. This was at 5.4, so 1c, all good. Anything below 6.5, okay, and this was after breakfast as well, so this is quite good. Alright, so now let's get into the bloods, and like some of these numbers are kind of high, some are kind of low, but you know, it's just because of everything that I've been through, and it's just some things I would think I can change, I can improve, and I think I will over the next few months before my next blood test. So now some of these numbers are high, yes, and there's a reason for that, which I'll go into, and there's a reason why not to worry about it as well. So iron, total iron, now anywhere between 5 and 30 millimole is healthy, and my total iron is at 15, okay, for this test. The transferrin, anything between 1.9 and 3.1 grams per liter, and mine's at 2.7, so bang on, perfect. Okay, next is TIBC. Now that's an important number to remember as well. Now this is total iron binding capacity, okay. So what it does is it measures the blood's ability to attach itself to iron and transport it around the body. Now, so-called normal healthy range is between 47 and 77 millimole per liter. Mine's at 69, so that's actually quite high. That's good. All right, so my body's ability to actually transport iron is actually quite good. My transsaturated iron, okay, transsaturation is at 22. Now between 20 and 45 is good, so that's a little low but not too bad, still healthy range, right, which is incredible. Our ferritin is high. Now this time my ferritin iron level was 374. Now between 30 and 300 is considered healthy. This can be a marker for liver disease, but the fact that my TIBC is quite high will show that it's actually not a liver problem. It's actually just that the amount of iron could be high in my liver because of scarring, and my liver does have scarring from chemotherapy. Now normally a high ferritin level could indicate liver disease, okay, depending on the other numbers like the TIBC. If your TIBC is low and you have high ferritin, that could be a sign of liver disease, but my TIBC is actually quite high. Now the reason why I might have high ferritin is because of liver scarring tissue. But this is actually lower than last time I had tested. Last time it was over 400. So it actually has improved, even though I do have a lot of liver scarring. And, the fact that, maybe my liver is improving. So that's really good. So I'm really happy with that actually. So even though this number is high, because my TIBC is quite high as well, that's the ability to actually transport and utilize iron, then there's really nothing for me to worry about. If that was low, again, then you might have a problem. My CRP is anything below 5, mine's at 0.5, Okay, so CRP is your C-reactive protein. Okay, and it just measures the level of CRP, a protein produced by the liver in response to inflammation. Okay, so this shows that I don't have liver disease, just some scarring there. Okay, so CRP is quite important as well. If the CRP was elevated and the TIBC was low, that would show a definite trace of liver disease. Okay, so actually I think my liver is actually quite healthy, even though it has scarring that may contribute to a high ferritin level. Okay, that obviously does. Okay, so start with the hemoglobin. Now total hemoglobin is 135. Our normal healthy range is 135 to 175 grams per litre, right? So I'm right on base healthy range, so that's pretty good. Now, after chemotherapy, especially after prolonged heavy dose chemotherapy like I've been through, cancer patients or chemo patients have a long-term and sometimes permanent effect on their blood cell production, okay, because it really affects your bone marrow, okay, to the ability to produce blood cells. So my hemoglobin, my white cells, red cells, platelets are always very low. It's a permanent side effect of chemotherapy. My hematocrit, now the hematocrit is a normal healthy range is 0.40 to 0.54. Mine is 0.40, so exactly right on base level again for normal healthy range, but much healthier than it used to be. My red cell count, okay, is 4.7. Now between 4.5 and 6.5 is normal healthy range. Again, this is just above baseline, okay. And MCV, which measures the size, the average size of red blood cells, okay. So mine's at 85, and anywhere between 80 and 100 is a normal healthy range. So again, a good result. Okay, so let's get into the white cell count. So neutrophils, now a normal healthy range is 1.5 to 6.5, and mine is at 2.05. So that's actually an improvement from last time, actually, so that's really good. Like total white cell count is 3.3, and so this is a little low. The normal healthy range is 3.5 up to 10. Alright, so still total a little low, but my neutrophils are higher than last time, so that's really good. Lymphocytes, okay, they're low this time, actually lower than last time, 0.85. Now normal healthy range is 1 to 4. I'm not too concerned. Like I said, I haven't done a lot of my routine the last couple of months because I've been trying to measure the difference. So that's actually dropped a bit from last time, which was just inside the normal healthy range. So again, lymphocytes or white cell counts, these are things that are measurably different in things like grounding and breath work and things like that. So that's something that's interesting to me, Okay, monocytes. Now, a normal healthy range is between 0 and 0.9. Mine's at 0.31. Sorry, mine's at 0.31, yeah. You got eosinophils. Now, a normal healthy range is between 0 and 0.6, and mine is at 0.08. So, low but good. Okay, basophils, now between 0 and 0.15, and mine are at 0.01. So this is good. Where I have a significant drop is my platelets. Again, this is another thing I wanted to measure. the difference between if it's all carnivore diet, or if it's part of the other things that I do as well. The 7 other habits that I like. This is a measurable difference from last time. Now, platelet production is normal healthy range. This time is between 150 and 400. Now, it used to be between 200 and 550, I think it was, but they've actually lowered the production, as they do, because normal healthy range gets lower and lower as the population gets sicker, right? Because this is done over averages, right? But this time my platelet production was down to 121. Okay, so like several months back, about 6 months ago, my platelets were inside the normal health. They're actually at 160. But the last actually 6 to 8 weeks, like I said, I've been trying to measure the difference, whether it's just carnivore diet that's changed that, or it's all of that combined. And without that combination, it's actually, my platelets have actually dropped. So, but it's still stable, It's not like when I was going through treatment, or when I was diagnosed, they were, double digits. They were very low. Okay. Okay, so comments on collection. Okay. Blood film has been reviewed and everything seems okay. Nothing to worry about. So I'm pretty happy with that, actually. Actually, I'm gonna, now that I've got these tests done, I'll get back into my routine, and hopefully next test I'll see a great improvement in those platelets, and I'll be able to measure the difference significantly. So that's what I'm working on at the moment. Okay, so we'll go through some of these other things. Alright, so it's really not a lot to go through here. Alright, so now let's get into the chemistry. There are a few highs and lows, but I won't go into detail for all of them because it's actually quite a bit there. As you can see, there's quite a list. All right. I think calcium is quite good. Now, again, people say calcium is low on the carnivore diet, for example, and like a normal healthy range for calcium is 2.1 to 2.60 millimole. All right, mine's at 2.27. Now, calcium is really important for many reasons. Okay, but as we get older, our ability to absorb and utilize calcium gets weaker. Okay, it can be improved with activity, like especially strength training. The cereal products like Stem Enhance Ultra. Okay, the Stem Enhance Ultra can improve that as well. It also has calcium in it, but to release more stem cells actually improves that ability for our mitochondria to use calcium as well. Now, calcium also helps us to regulate heartbeat and contraction, muscle contraction. Our mitochondria's ability to use calcium will have an effect on our ability to have strong muscle contractions. Okay, so good for muscles, good for brain, good for everything really. So very good. So carnivore diet for the win again. All right. Now that's all good. Urea, creatine. Okay, creatinine is high now, between 60 and 110 millimole units of millimole per liter. Is a normal healthy range. Mine's at 133. It's actually dropped since last time. Now there's a couple of causes for that, because if you carry more muscle mass, you're going to have a higher creatinine level. Other reasons why you might have higher creatinine levels is your kidney function. Now, my kidneys have a lot of scarring, so of course there's kidney function issues, renal issues and things like that. So that's another reason why the creatinine might be high. And other things that might cause problem is, or creatinine spikes, are things like casein from dairy products, if you have, especially if you have kidney scarring like I do. So that's another good reason to avoid dairy products as an adult. All right. EGFR, now that's your like kidney function, your overall kidney function. Okay, EGFR is actually low. Anything over 59 is a normal healthy range. Mine's at 53. Now that's pretty good because I only have one kidney working, so I'm pretty happy with that. But of course on these tests it's going to show up as a low. Alright. Okay, glucose levels at 5.4. Okay, so that's good. Anywhere between 3.6 and 6.0 is good. This was after breakfast, so yeah, it's actually quite good, quite low. Okay, total protein is actually low this time. Alright, so total protein, a healthy range is 63 to 80 grams per litre. Mine was at 61 per litre. Just at the time of that test, that doesn't really mean anything. It's not anything to worry about. Okay, albumin is at 44, and that's been the same for the last, let me see, 4 tests. Exactly the same at 44, so it's very stable. Anywhere between 32 and 44 grams per litre is a normal healthy range. Globulin is low, now between 23 and 43 grams per litre is a normal healthy range. Mine's at 17. Now here again, well, like I was talking about liver function before, liver damage because of high ferritin levels, is the T bilirubin. Okay, now this is a yellowish sort of pigment produced during the normal breakdown of red blood cells in your liver. Okay, and the bilirubin test measures its levels in the blood to assess liver health and identify potential problems. So if you have a high bilirubin level, obviously you have a damaged liver. Now anywhere between or anything lower than 21 units of millimole per litre is healthy, and mine is at 12. So again, there's really no reason for me to worry about the high ferritin level. It's not a sign of liver disease or anything else. It's just a sign of damaged liver due to scarring, probably largely due to the chemotherapy. Okay, so this time, okay, let's go down to the next high, or the next one is cholesterol and triglycerides. Everyone's sort of worried about that on carnivore diet, right? In Australia at the moment, the marker for high cholesterol is 5.6 millimole per litre, and at this particular test it was 4.4. Okay, so obviously nothing to worry about on the carnivore diet, right? Okay, my hemolysis index, this has actually dropped quite a bit. This actually assesses the red cell breakdown in your so anything below 40 milligrams per deciliter, okay, is considered healthy. Mine's at 3. Now it was much higher, even going back 6 months it was at 7, but this time it's only 3, so that's really good. So it means it means that my red blood cells are not breaking down so easily anymore. They're actually living longer. That is actually proof. And as something, I know a lot of people have been saying that there's a possibility that carnivore A1C might be elevated due to the fact that their red blood cells live longer. Well, you know, this is proof. You know, this is actually my red blood cells are not breaking down as fast as they used to, as much as they used to. Okay, so that is the breakdown of my latest tests so far. I do have more results coming from the CT scan and follow-up blood tests, but at the moment it shows that I have no evidence of disease. The only things that I do have any sort of concern of the scarring on my organs. So there are a few elevated and a few low counts there. I will probably always have a low platelet count and blood cell count. But at the moment it shows that what's interesting is that the difference between just carnivore diet and the other habits that I like to do each morning each day, such as breath work and grounding and other things like that. So I'm looking forward to my next test because I'll be able to show a measurable difference. And apart from that, everything is fantastic. And so, I mean, it's been amazing that I've made it this far, but now to show no evidence of disease is incredible. Of course, I will continue to monitor my bloods, and I do daily. I do my blood glucose levels and everything like that. But at the moment, everything is really good, and I mean, I hardly know what to say at the moment, to be honest. And it's like they never expected me to make it through the first treatment in 2012. Then again in 2014, I almost didn't. Here I am, and like I said, I think this is really important for anyone that has this disease or any similar disease like cancer. I think there is something you can do about it. Don't let the doctors convince you that there's nothing that you can do about it, or that they have all the answers either, because they don't. They just simply do not have all the answers. And sometimes you need to think outside the box. And again, I think in this very unnatural world, we need to live as naturally as we can, at least mimic as much natural life as we can anyway. And you can't escape everything. So I don't think you have to be obsessive. I've never been obsessive about it. I've got a whole new life to build now. So it's a great result. So it's reinforcing the fact that everything I've done up till now has been working, albeit slow. It is a slow process, healing the body, and I hope that I can improve it more. I'm not sure there's really much I can do about organ scarring and things like that, but we'll see. And I have a short little AI summary for you at the end of this, so keep watching, and I hope you enjoy it. Apart from that, alright guys, I will catch up with you soon, and I hope you all have a great day or night wherever you are.
Hey, I'm DC. After 3 years of chemo hell, I'm still figuring out what it all did to me. Body, brain, and even my DNA. Here's what I've learned about what chemo does, tied to my experience. This is what chemo does. It hits you with drugs and radiation to kill cancer, but it doesn't stop there. It scars your organs, messes with your blood, and rewires your brain. My experience? I went through 8 rounds of R-CHOP, cyclophosphamide, doxorubicin, vincristine, prednisone, and rituximab, then 18 rounds of radiation, 14 months of rituximab, 8 rounds of bendamustine, and a stem cell transplant with high-dose beam, carmustine, etoposide, cytarabine, melphalan. It was a war and I won, but the battlefield's still me. This is what chemo does. It scars your kidneys, thickens your bladder, and stresses your liver. Cyclophosphamide from R-CHOP can inflame your bladder, leaving it stiff. Radiation and bendamustine scar your kidneys and liver. Transplant chemo like carmustine adds more fibrosis. My experience? My kidneys are scarred with fluid buildup, low function, hydronephrosis, my bladder wall's thicker from all that irritation. My liver's got damage too, ferritin's at 400 micrograms per liter, a sign of stress, though TIBC 69 micromoles per liter and TSAT 22% say it's inflammation, not iron overload. CRP's 0.5 milligrams per liter, no acute crisis, just chronic scars. This is what chemo does. It hammers your bone marrow, dropping your blood counts. R-CHOP, bendamustine, and BEAM wipe out white blood cells, red blood cells, and platelets, and even a transplant doesn't fully fix it if kidneys and liver lag. My experience? My white blood cells are low, infection risk. Red blood cells are down, fatigue hits. Platelets are low, bruising's easy. Even after transplant, your marrow's ability to produce platelets is permanently diminished. This is what chemo does. It fogs your brain and can scar it long-term. Doxorubicin and cyclophosphamide spark inflammation, vincristine's neurotoxic, radiation shrinks white matter, BEAM's carmustine and cytarabine hit speech and focus hard. It can amplify ADHD by tweaking dopamine genes or slowing signals. My experience? Chemo fog was horrible, couldn't think straight for years. Post-transplant, I couldn't speak coherently for years. Carmustine and cytarabine likely scarred my brain's speech areas. I had ADHD before, but this cranked it up. Articulation's still tough, though it's improving 10 years out. This is what chemo does. It mutates your DNA and tags it epigenetically. Alkylators like cyclophosphamide, carmustine, and bendamustine break DNA strands, radiation smashes it, doxorubicin adds oxidative hits. Epigenetic shifts silence or boost genes maybe forever. My experience, my brain's DNA took hits. Mutations or tags in dopamine genes might have worsened my ADHD. White matter scars slowed my speech recovery. It's not my whole code rewritten, just battle scars in my cells. This is what chemo does. It sets limits, but you adapt. My experience, it makes it harder to do everything. You have strong fatigue and more. But the fight goes on with the carnivore diet and my 7 habits to help restore my body. I am continuing to heal, grow, and learn again. I don't use it as an excuse to do nothing. I used as a reason to try harder. Chemo changes you, but it's up to you if let it stop you or motivate you. This is what chemo does. It changes you, but it doesn't own you. My experience? 10 years in remission, I'm learning again. Learning to live. Now building a new life. ADHD's louder, speech isn't perfect, but I'm improving. Supplements destroy organs, especially if they are already scarred. Carnivore diet matches my conditions. Chemo leaves permanent scars, but my fight goes on.